Hello to everyone. I'm Dr. فرشته صداقت, and we will continue with the second part of the neuromodulation of central nervous system. Since the aim of what is learning, some questions will be shown meanwhile to be able to test yourselves. Here we will learn a little about transcranial magnetic stimulation, transcranial focused ultrasound, neurofeedback, audiovisual entrainment, and transcranial direct current stimulation. So, transcranial magnetic stimulation is an electromagnetic induction therapy that uses magnetic fields for stimulating nerves in the brain. The principle behind this therapy is that when a magnetic field passes through a coil, an electrical current will be produced in the coil, which can stimulate neural networks. This therapy has been used to treat depression and other mental disorders since 2005. Each treatment session lasts about 30 minutes. rTMS stands for repetitive transcranial magnetic stimulation. The treatment duration usually lasts between 4 and 6 weeks. This number of weeks could be shorter or longer depending on every person's response. The exact biology of why rTMS works isn't completely understood. Here we can see the cerebral blood flow increases after doing TMS in a patient with depression. The patient's symptoms has been improved. A person who has metallic fragments in the body should not do TMS, like aneurysm clips or coils, stents, implanted stimulators, implanted vagus nerve or deep brain stimulators, implanted electrical devices, electrodes for monitoring brain activity, cochlear implants for hearing, any magnetic implants, bullet fragments, any other metal device or object implanted in the body. Transcranial focused ultrasound is an emerging brain stimulation tool for safety modulating brain circuits. It uses low intensity, low frequency ultrasound to stimulate neural activity and was proposed in 2002. The effectiveness of focused ultrasound activity on human brain has been demonstrated, and on hippocampal sonication with low intensity transcranial focused ultrasound, the scientists have been seeing effects on cerebral blood glucose metabolism and cognitive function improvement in patients with Alzheimer's disease. It has direct action on bioelectrical neural activity, and in addition could be used for targeted drug delivery. Compared entrainment is a technique in which lights flash into the eyes while tones pulse into the ears. The frequency of the lights and the tones is in the brain wave frequency range, typically from 1 to 40 Hz. The brainwave synchronizer works on the principle of entrainment. This technique was introduced in 1959. The lights and sound from the synchronizer pulse at the speed of normal brain waves, as I said before. Our brain waves will then follow as the light and sound stimulation and shift into the frequencies of another mind state. This is called the frequency following effect. In 1963, it was reported a 90% success rate at reducing anesthesia during surgery while using this device. Bernard Margulis used it in the first brainwave entrainment in dental study in 1966, which reported less need for anesthesia, also less bleeding and less fear and anxiety. And also Dr. Kroger used it to help 200 female subjects enter hypnosis to assist childbirth in them. In order for entrainment to occur, a constant, repetitive stimuli of the proper frequency and sufficient strength to excite the thalamus must be present. All sensory information except that of smell must pass through the thalamus to gain access into other brain regions. The thalamus then passes the stimuli onto the cortex and associated processing areas such as the visual and auditory cortex. For instance, induced visual stimulation travels from the retina of both eyes down the optic nerve through the optic chiasm and into the lateral geniculate of both thalami. From here, the visual signals are passed onto limbic structures and then visual cortex. Audiovisual entrainment is avoided in those with photosensitive epilepsy, where flashing lights of certain frequencies may trigger a seizure. And now, transcranial electrical stimulation. It's the most clinical experience has been done with electrical stimulation, and it was used for more than 200 years based on the experiments of Aldini. The history of neuromodulation goes as far back as ancient times when electric fish were used to treat pain. The simultaneous firing of electrocytes results in the electric organ discharges which are emitted in the surrounding water. The stronger electric fishes such as the electric eel, electric catfish and electric rays, the electric organ is huge, containing numerous electrocytes. Therefore, their discharge voltage can reach as high as 600 volts. In weakly electric fishes, which use electricity for navigation and communication, the discharge voltage is small, often less than a volt. Transcranial current stimulation works by sending low current through the electrodes. When these electrodes are placed in the region of interest, the current induces intracerebral current flow and alter neuronal excitability in the specific area being stimulated based on which type of stimulation is being used. This change of neuronal excitability leads to alteration of brain function, which can be used in various therapies as well as to provide more information about the functioning of the human brain. Till now, various and different devices for electrical stimulation have been made. There are different modes of transcranial electrical stimulation. tDCS, transcranial direct current stimulation, begins with a ramp up phase and ends with a ramp down phase. It is used most than the others in clinical practice. In transcranial alternating current stimulation, alternating forms of electrical current at a specified frequency can be applied. In random noise stimulation, unlike alternating current stimulation, the intensity of the current and frequency of the current change in a randomized way. The type of noise that is administered can be changed by adjusting the frequencies present within the random noise waveform. And there is transcranial pulse current stimulation, that is a biphasic pulse alternating current. Transcranial alternating current stimulation provides a rhythmic waveform that can be customized to target specific neural oscillations. The electrode montage can be customized to target any cortical region of interest. Although the mechanism behind these modes remains not entirely certain, there are some interesting phenomena that remain to be investigated in future. There are a variety of applications for using TES, depression, migraine, stroke rehabilitation, stuttering, cognitive decline, chronic pain, vertigo, tinnitus, cerebral palsy, Parkinson, insomnia, anxiety disorder, and cognitive enhancement are amongst them. There are different montages to be used based on the indication. In case of treating depression, for example, tDCS currents specifically target the left side of dorsolateral prefrontal cortex. This region has been shown to be associated in depression. tDCS is able to achieve cortical changes even after the stimulation is ended. The duration of this change depends on the length of the stimulation as well as the intensity of the stimulation.